Virtually every successful professional can tell a story about how a mentor played a key role in his or her development. But perhaps nowhere is mentorship more important than in medicine. That's why I'm pleased to have the opportunity to be here with all of you today to emphasize the value that we place on clinical mentorship. Because of the importance we believe that clinical mentorship plays in the fight against HIV and AIDS, the US government is committing $4 million over the next 2 years to create a cadre of clinical mentors who will help strengthen Namibia's human resources in public health. A lot of time and hard work has gone into planning this clinical mentor program, a program designed to reach the almost 40,000 Namibians who are still in need of antiretroviral treatment services across the country. I want to thank all of you who have been involved in making this happen, from the Ministry of Health leadership to the technical staff, nurses, and doctors who are on the front lines in the HIV response. I'm sure that many of you are aware of the latest test and start guidelines from the World Health Organization. These new guidelines are based on new data that show that antiretroviral treatment reduces overall mortality as well as reducing other diseases. My question to you is, are you actively sharing this information with your colleagues? That, in the end, is your role. That's why you are here today, to learn and then to share your new knowledge with your colleagues, the other Namibian health professionals who aren't here. We are counting on you to help show them the way, to share your knowledge and experience, and thereby build a healthier and more prosperous Namibia. This week you will learn how to manage patients with HIV more effectively, how to monitor viral load, and how to use new mobile data collection tools for monitoring and evaluation. You'll also get a sneak peek at new mobile technology that will enable you to take your cell phone into the field to collect and analyze patient data right from your phone. You are the trailblazers. And I have to say, I've seen some of this technology and it's pretty cool stuff, so you're in for a treat.
HIV is still the leading cause of death in Namibia. We still have several thousand of patients who need the treatment but have not yet put on the life-saving antiretroviral treatment. There are still individuals who are HIV infected but have never been tested for it and hence don't know their status. We have HIV infected individuals who have not yet been linked to care. Some of our patients default from HIV care and treatment, and this may lead to development of HIV-resistant progression of HIV diseases to AIDS and possible death. All this could affect our desired progress to achieve HIV epidemic control. The expansion of the clinical mentoring program will clearly increase the penetration of technical support up to remote part of the country. Nurses, pharmacy staff, and doctors working in remote rural setting will now get readily available hands-on technical support. We are also fortunate to get the opportunity to be piloting the expansion of community healthcare outcomes and model of virtual training and mentoring as the first country in Africa.